Welcome to PharmaconHealth. Here is a question every clinician, nurse, and pharmacist faces every single day. A child weighs 12 kilograms, and the drug dose is 20 milligrams per kilogram. How many milligrams does this child need? Or, a patient has poor kidney function. Do we give the same dose, a smaller dose, or a different drug entirely? Getting the answer right means the patient recovers. Getting it wrong means toxicity, treatment failure, or death. In this video, we will build your complete, practical understanding of dose calculation, from the simplest weight-based formula to body surface area dosing and kidney function adjustment. By the end of this video, you will understand why dose calculation matters and what happens when it goes wrong. You will be able to use weight-based dosing, the most common method in clinical practice. You will apply Young's rule for age-based dosing in children. You will calculate doses using body surface area with the Mosteller formula. You will know how to adjust doses when the kidneys or liver are not working properly. And you will work through fully solved example calculations for each method, step by step. Let us start at the beginning. Why dose calculation matters, and what the consequences of getting it wrong look like in real patients. Think of dose calculation like filling a cup with water. Too little and the person stays thirsty. The drug does not work. Too much and the cup overflows. The drug becomes a poison. The goal is always to hit the zone in between, enough drug to treat the condition, not so much that it causes harm. This zone is what we call the therapeutic window, the safe and effective range. In clinical pharmacology, underdosing causes treatment failure. Overdosing causes toxicity. Both are dangerous. Both are preventable with correct dose calculation. According to the World Health Organization, medication errors, including incorrect dosing, are responsible for approximately 1.3 million injuries per year in high-income countries alone. Most of these errors are preventable. Now let us learn the methods, starting with the simplest and most commonly used, weight-based dosing. Weight-based dosing is the most widely used method in both pediatric and adult clinical practice. The formula is beautifully simple. The total dose in milligrams equals the dose per kilogram multiplied by the patient's weight in kilograms. For example, if a drug is prescribed at 5 milligrams per kilogram, and the patient weighs 30 kilograms, the total dose is 5 times 30, which equals 150 milligrams. It is direct, fast, and, when applied correctly, highly reliable. The correct dose is not the same for everyone. 6 patient-specific factors change how much drug should be given. First, body weight. Heavier patients generally need more drug because the drug distributes into a larger volume. Second, age. Newborns, children, and elderly patients have different enzyme activity and body composition compared to adults. Third, body surface area. For potent drugs like chemotherapy, the body surface area is a more accurate predictor of drug distribution than weight alone. Fourth, kidney function. Many drugs and their breakdown products are removed from the body by the kidneys. Poor kidney function means drugs stay in the body longer and accumulate. Fifth, liver function. The liver is the main site of drug metabolism. Liver disease slows metabolism and increases drug levels. Sixth, route of administration. The same dose given by mouth and by injection into a vein will produce very different blood levels because oral drugs must pass through the gut and liver. Before reaching the bloodstream, let us work through a complete clinical example step by step. A 15-kilogram child is prescribed amoxicillin at a dose of 20 milligrams per kilogram per day, to be given into divided doses. What is the total daily dose, and what is the dose for each individual administration? Step 1. Calculate the total daily dose. Total daily dose equals 20 milligrams per kilogram multiplied by 15 kilograms, which gives 300 milligrams per day. Step 2. Divide into individual doses. 300 milligrams divided by the doses equals 150 milligrams per dose. So this child receives 150 milligrams of amoxicillin twice a day. This is a calculation every clinician and pharmacist must be able to do in their sleep. Now let us look at age-based dosing, a method specifically designed for pediatric practice when you know a child's age but may not have precise weight data. Age-based dosing formulas were developed before accurate weighing scales were widely available, and they are still used today as quick estimates, particularly for over-the-counter medications and NS. Settings where weight measurement is not immediately possible. The key principle is this: a child's dose is a fraction of the adult dose, and that fraction is calculated from the child's age. Two formulas are most commonly used. Young's rule uses the child's age in years divided by the child's age plus 12, then multiplied by the adult dose. Dilling's rule is even simpler: the child's age in years divided by 20, multiplied by the adult dose. Both give an approximate starting point. Important limitation: neither formula accounts for a child's actual size, body composition, or organ maturity, so they are estimates, not precise calculations. For potent or narrow therapeutic index drugs, weight-based or body surface area dosing is always preferred. Let us apply Young's rule with a complete worked example. A 6-year-old child needs a medication. The adult dose is 200 milligrams. What dose should this child receive? Step 1. Write the formula. Child dose equals age divided by age plus 12, all multiplied by the adult dose. Step 2. Substitute the numbers. Child dose equals 6 divided by 6 plus 12, multiplied by 200. Step 3. Solve the bracket first. 6 plus 12 equals 18. Step 4. Divide. 6 divided by 18 equals 0.33, which is 1/3. Step 5. Multiply. 1/3 multiplied by 200 equals 66.7 milligrams. So the child receives approximately 67 milligrams. Notice that this is roughly 1/3 of the adult dose, which makes intuitive sense for a 6-year-old. Now let us use Dilling's rule for the same patient, a 6-year-old. Adult dose 200 milligrams. Step 1. Write the formula. Child dose equals age divided by 20, multiplied by the adult dose. Step 2. Substitute. Child dose equals 6 divided by 20, multiplied by 200. Step 3. Divide. 6 divided by 20 equals 0.3, that is 30%. Step 4. Multiply. 0.3 multiplied by 200 equals 60 milligrams. So Dilling's rule gives 60 milligrams, close to the 67 milligrams from Young's rule. Both formulas agree closely for this age. As the child gets older, the two formulas may diverge slightly. Always document which formula you used and confirm with a pharmacist for any drug with a narrow safety margin. Now let us move to a more precise method, body surface area dosing, which is essential for chemotherapy, pediatric intensive care, and any drug with a narrow therapeutic index. Body surface area, the total surface of a person's skin, correlates more closely with many physiological parameters than body weight alone. Cardiac output, kidney filtration rate, and metabolic rate all scale with body surface area rather than weight. This is why, for potent drugs where small errors have large consequences, like cancer chemotherapy agents, Dosing based on body surface area is more accurate than weight-based dosing. The standard adult body surface area is 1.73 square meters. A child's body surface area is smaller, and their drug dose is calculated as a fraction of the adult dose proportional to their body surface area. The most widely used formula to calculate body surface area is the Mosteller formula. Body surface area in square meters equals the square root of height in centimeters. Multiply by weight in kilograms, all divided by 3,600. Let us work through a complete body surface area calculation. A child is 110 centimeters tall and weighs 18 kilograms. The adult dose of the medication is 200 milligrams. What dose should this child receive? Step 1. Calculate the child's body surface area using the Mosteller formula. Body surface area equals the square root of 110 multiplied by 18. Divided by 3,600. Step 2. Multiply 110 by 18 to get 1,980. Step 3. Divide 1,980 by 3,600 to get 0.55. Step 4. Find the square root of 0.55, which equals approximately 0.7 square meters. Step 5. Now apply the dose formula. Child dose equals the child's body surface area divided by 1.73 multiplied by the adult dose. That is 0.7 divided by 1.73 multiplied by 200. Step 6. 0.7 divided by 1.73 equals approximately 0.3. Step 7. 0.3 multiplied by 200 equals 85.5 milligrams. The child receives approximately 86 milligrams. How do you choose between weight-based, age-based, and body surface area dosing? Here is a simple guide. Use weight-based dosing, milligrams per kilogram, for most everyday medications, antibiotics, pain medications, and most drugs in both children and adults. This is your default method. Use age-based dosing, Young's rule or Dilling's rule, only when you do not have access to accurate weight data, or for simple over-the-counter medications where precision is less critical. Use body surface area dosing when precision is non-negotiable. Chemotherapy agents, drugs with a very narrow therapeutic index, and in the pediatric intensive care unit where even small dosing errors can be fatal. Simple rule: more dangerous drug gives more precise method. Now let us tackle one of the most important and most exam-tested topics in clinical pharmacology: dose adjustment when the kidneys or liver are not working properly. The kidneys are responsible for removing most drugs in their breakdown products from the body. When kidney function decreases, drugs are cleared more slowly and their levels build up in the blood, potentially reaching toxic concentrations even at a standard dose. The most important measurement of kidney function for dose adjustment is the creatinine clearance rate, a measure of how efficiently the kidneys filter the blood. The most commonly used formula to estimate creatinine clearance is the Cockcroft-Gault formula. Creatinine clearance equals 140 minus the patient's age, multiplied by their weight in kilograms, divided by 72 multiplied by the serum creatinine level in milligrams per deciliter. For female patients, multiply the result by 0.85. Once you know the creatinine clearance rate, you can reduce the dose, increase the interval between doses, or choose a different drug that does not depend on kidney excretion. The estimated glomerular filtration rate, a modern equivalent often reported automatically by laboratory systems, is used in the same way for dose adjustment decisions. Here is a practical renal dose adjustment example. A 60-year-old male patient weighing 70 kilograms has a serum creatinine level of 2 milligrams per deciliter, which is elevated. He needs an antibiotic that is normally dosed at 500 milligrams every 8 hours. His creatinine clearance must be calculated first. Applying the Cockcroft-Gault formula, 140 minus 60 equals 80. 80 multiplied by 70 equals 5,600. 72 multiplied by 2 equals 144. 5,600 divided by 144 equals 38.9 milliliters per minute. This patient has a creatinine clearance of approximately 39 milliliters per minute, which falls in the moderate impairment range. For this level of kidney function, the antibiotic dose would typically be reduced to 250 milligrams every 8 hours, or the original 500 milligrams given every 16 hours instead. A pharmacist should always confirm the final adjustment. The liver is where most drugs are broken down, metabolized, before they are eliminated from the body. When the liver is damaged, this breakdown process slows down, and drugs stay in the body at higher concentrations for longer than expected, and like kidney function. There is no single simple blood test that directly measures how well the liver metabolizes drugs. Instead, clinicians use the Child-Pugh score, a scoring system that combines 5 clinical and laboratory findings to classify liver disease severity. The 5 components are serum bilirubin level, serum albumin level, prothrombin time prolongation, a measure of the liver's ability to make clotting factors, the presence and severity of ascites fluid in the abdomen, and the presence and severity of hepatic encephalopathy confusion caused by liver failure. Each component is scored 1 to 3, giving a total score between 5 and 15. A score of 5 or 6 means mild liver disease, Class A minimal dose adjustment needed. 7 to 9 means moderate disease, Class B, significant dose reduction required. 10 or more means severe disease, Class C. Many drugs should be avoided entirely. Now let us put your knowledge to the test with a set of practice questions, because dose calculation is a skill, and skills only develop through practice. Question 1. A 10 kilogram child is prescribed ibuprofen at a dose of 10 milligrams per kilogram. What is the total dose in milligrams? Pause the video and try to calculate it before we reveal the answer. Ready? The answer is simple. 10 milligrams per kilogram multiplied by 10 kilograms equals 100 milligrams. The child receives 100 milligrams of ibuprofen. If the medication comes as a suspension with 100 milligrams per 5 milliliters, the child would receive 5 milliliters, 1 teaspoon, per dose. Question 2. Use Young's rule to calculate the dose for an 8-year-old child. The adult dose is 400 milligrams. Pause and calculate. The formula is child dose equals age divided by age plus 12, all multiplied by the adult dose. Substituting 8 divided by 8 plus 12, multiplied by 400. 8 plus 12 equals 20. 8 divided by 20 equals 0.4. That is 40%. 0.4 multiplied by 400 equals 160 milligrams. The 8-year-old receives 160 milligrams. Notice this is exactly 40% of the adult dose. A useful sanity check. An 8-year-old weighing roughly 25 kilograms should need considerably less than an adult, so 40% seems reasonable. Question 3. This is the most clinically important type of calculation. A 65-year-old female patient weighing 60 kilograms has a serum creatinine of 1.8 milligrams per deciliter. A doctor has prescribed metformin, a diabetes medication that is primarily excreted by the kidneys, before dispensing. You need to calculate her creatinine clearance to determine if metformin is safe to use. Apply the Cockcroft-Gault formula, remembering to multiply by 0.85 because she is female. Pause and calculate. 140 minus 65 equals 75. 75 multiplied by 60 equals 4,500. 72 multiplied by 1.8 equals 129.6. 4,500 divided by 129.6 equals 34.7. Multiplied by 0.85, because female, gives 29.5 milliliters per minute. This is below 30 milliliters per minute. Severe kidney impairment. Metformin is contraindicated at this level of kidney function due to the risk of a dangerous buildup of lactic acid. The drug should not be dispensed. This is a potentially life-saving calculation. Let us now bring everything together in a clear, comprehensive summary that you can use as a quick revision guide. Here is your complete summary of dose calculation in pharmacology. Method 1. Weight-based dosing. Total dose in milligrams equals dose per kilogram multiplied by body weight in kilograms. This is the default method for most drugs in both children and adults. Method 2. Age-based dosing. Young's rule gives child dose as age divided by age plus 12, multiplied by adult dose. Dilling's rule gives child dose as age divided by 20, multiplied by adult dose. Use these only as quick estimates for low-risk medications when weight is not available. Method 3. Body surface area dosing. Calculate body surface area in square meters using the Mosteller formula. Square root of height in centimeters multiplied by weight in kilograms divided by 30,600. Then apply the dose formula. Body surface area divided by 1.7. 3. Multiplied by adult dose, used for chemotherapy and narrow therapeutic index drugs. Kidney adjustment, use the Cockcroft-Gault formula to estimate creatinine clearance, then reduce dose. Extend interval, or change drug as indicated. Liver adjustment, use the Child-Pugh score. Class A means minimal adjustment, Class B requires dose reduction. Class C means avoid many drugs entirely. If this video has made dose calculation clearer and more manageable for you, please subscribe to PharmaconHealth and share it with your classmates and clinical colleagues. Thank you for learning with PharmaconHealth, where pharmacology protects lives.